this is Dr. Ross Nash from the Nash Institute for Dental Learning here in Charlotte, North Carolina. With today's aesthetic dentistry, the use of an articulator and facebow have become much more critical. When restoring anterior teeth, the facebow record provides critical information for your laboratory and will help you obtain predictable results. The Denar Slidematic Facebow is so easy to use that I almost always have my assistant take this vital record. Comprehensive treatment planning and documentation of existing conditions is simplified by the use of instrumentation. Here at the Nash Institute and in our faculty practice, we use the Denar Slidematic. It takes only minutes and has saved valuable chair time on the delivery of our cases. I use the Denar Combi articulator because it's so simple and easy to use. Later in this video, you will see the Animark Denar articulator. I have found them both to be good choices for semi-adjustable articulators. Based upon several comprehensive studies by clinicians and educators, the criteria for development of the Slidematic were established. The Denar Slidematic was designed to satisfy the following requirements. Number one, a rigid and accurate ear bow that moves straight horizontally for different facial widths, unlike other facebows that move off the axis. Number two, a self-centering ear bow that automatically adjusts to the center of the patient's face. And number three, the ability to quickly and easily transfer this relationship to the articulator without loss of accuracy. The detachable transfer jig on this system can be sent to the laboratory for mounting. The facebow always stays in your office for use with your next patient. The ability to use multiple transfer jigs with one measuring bow greatly reduces the cost of the system. With today's emphasis on incorporating aesthetics with function, conveying the correct incisal plane via the maxillary cast to the articulator becomes mandatory. A canted incisal plane in the final restoration is aesthetically unacceptable and is avoidable by using the facebow. It takes only 2 to 3 minutes to perform. The procedure of taking the facebow record shows the patient that you are willing to take the time necessary to provide optimal and comprehensive care. Let's take a trip to the operatory and watch the process.
These are some of the representative samples of supplies needed to take an accurate facebow transfer. The Denar ear bow with its reference pointer index, the receiving port on the underside is indexed for proper assembly of the vertical shaft. The vertical shaft has 2 clamps that will require tightening. Number 1, followed by number 2. The facebow bite fork with index notch, the reference plane locator that measures an average distance from the incisal edge to a third point of reference, a red marker, a rigid or reinforced cotton roll, an acrylic facebow registration material such as Luxabite by Zenith. Other acceptable materials include Regisil Rigid by Caulk, Take One Bite by Kerr, or any hard baseplate wax. We will begin by loosening the finger lock screw on the front of the ear bow. Attaching the vertical shaft assembly and tightening the locking screw. Again, note that the shaft and the receiving port are indexed for proper alignment. The facebow is now assembled and ready for use. Before taking the facebow, explain the procedure to your patients so that they will know what to expect. We will begin by determining the third point of reference. To do this, align the reference plane locator with the incisal edge of the patient's right lateral incisor and gently indent the skin with the tip of the locator. With your marker, now mark the indentation point. Next, using your registration material, in this case we will be using Luxabite, extrude the material onto the bite fork. Seat the bite fork on the upper teeth with the bite fork arm to the patient's right and the index notch aligned with the patient's midline. Hold until material has begun to set, and then place a rigid cotton roll to support and stabilize the bite fork until fully set. Now loosen the finger screw on the measuring bow and open the bow to accommodate for the width of the patient's face. With thumb screws loosened on clamps number 1 and 2, now insert the bite fork arm into clamp number 2. Gently close the bow together with the patient's help as you guide the earpieces into both ears and tighten the center wheel on the bow. Next, align the reference pointer with the reference mark made earlier and gently tighten the screw that holds the reference pointer on the bow. Raise or lower the bow to ensure that the pointer is aligned precisely with the reference mark. Then tighten thumb screw number 1. At this time, only gently tighten thumb screw number 2. Next, have the patient stand with the head parallel to the floor and looking directly ahead. Observe the patient from the front and side to verify that the bow is aligned horizontally with either the patient's pupils or parallel to the floor and aligned vertically with the reference mark. It may be helpful to use a straight object, such as a mirror handle or a pinnacle brush, to check this alignment and adjust ear bow as needed. While stabilizing the bow securely with one hand, now tighten thumb screw number 2. Loosen the finger screw on the measuring bow, slide the bow open, and remove the entire facebow assembly from the patient. Once removed from the patient, again check to ensure that thumb screws number 1 and number 2 are securely tightened. Loosen the screw on the front of the bow and separate the transfer jig from the ear bow. Lastly, place the Denar bite fork and attached transfer jig assembly into a storage medium marked with the patient's name and date.
Now that you've taken the facebow transfer record and other necessary occlusal registrations, let's go to the dental laboratory and watch the mounting process.
Shown here are the necessary instruments and supplies for the proper mounting of study models using the Denar articulation system. Neatly trimmed and groomed upper and lower study casts, centric relation bite records, protrusive bite records, bite fork registration, the Denar articulator with attached magnetic converter plates, maxillary cast support, disposable magnetic mounting plate or mounting plate with a pre-added stone base for use in cases where a large space exists between the mounting plate and the base of the model. Allen wrench to set and tighten the condylar foci. Mounting index. Supplies for luting upper and lower models together, such as bent coat hangers or other similar forms of rigid stabilizers, and compound sticks. Hand instruments for grooming the study casts. Bard Parker knife for trimming bite records. A millimeter ruler. Sharp pencil. String. Or heavy gauge rubber bands to secure the models during the setting of the mounting stone. Articulating paper or ribbon. Wet dry sandpaper. Bunsen burner, an alcohol or micro torch, and lighter. The necessary instruments and supplies for mounting the upper cast are shown here. The Denar articulator with incisal pin set to 0. The upper study model. Magnetic disposable mounting plate. Facebow registration. Mounting index. And maxillary cast support. We will begin by removing the incisal guide table and replacing it with the mounting index. Tighten to secure. Next, remove the lower converter plate . Attach the maxillary cast support and tighten to secure it to the articulator's base. Note that the vertical shaft of the facebow assembly and receiving area of the mounting index are flat on one side, thus allowing for ease in orientation. Now insert the facebow assembly into the mounting index and tighten the thumb screw. Raise or lower the cast support bar to adequately stabilize the bite fork and model during the mounting phase. Check to ensure the cast support is properly positioned and tightened securely by gently pressing down on the bite fork and noting its stability. Adjust if needed for proper support. Attach the upper disposable mounting plate and place the upper model onto the bite fork record. Lower the upper member of the articulator and note the amount of space between the base of the model and the mounting plate, and hence the amount of mounting stone that will be needed. Prior to the addition of mounting stone, roughen the base of the model and moisten with water. These steps will improve the adhesion between the model and mounting stone. Mix the proper proportion of mounting stone and water according to the manufacturer's directions. Note that the use of cold water will increase your working time slightly. Next, place only enough of the mounting stone on the model's base to fill the space between it and the mounting plate. Lower the upper member of the articulator and begin removal of any excess stone with a small spatula or your finger. Be sure to keep a firm grasp on the articulator as you remove the excess so as not to distort the position of the model on the bite fork or drop the articulator itself. Continue to smooth the stone with moistened fingers, and you will note that the stone will begin to reach its initial set rather quickly. Secure the articulator firmly with either a fairly heavy-duty string or heavy-gauge rubber bands to reduce any positional distortion that may occur from any slight expansion of the mounting stone during its set. Allow a minimum of 30 minutes before removing the model. Once the mounting stone has reached its set, the upper model can be removed. Position the lower model against the upper in maximum intercuspation. With a sharp pencil, mark a point close to the incisal edge of one of the maxillary incisors. Next, mark a line on the base of the lower model directly below the above reference mark. Using a millimeter ruler, measure the distance between these two reference marks. Next, place the opened vertical centric relation bite record on the upper model and position the lower model into this record. It is imperative that the bite records are properly trimmed to allow complete seating of the models into the record. Inspect that the fit between the teeth and bite record material is precise. It is also important to note that the use of some of the less rigid polyvinyl bite registration materials can distort to fit the models and thus lead to an inaccurate mounting. For this reason, it is advisable to use a bite registration material that, once set, is very rigid or use a firm wax as shown here. With the bite record interposed, again measure the distance between the same two reference marks. Note that the difference between these two measurements represent the amount of opening needed at the incisal pin. In this case, the amount of opening is slightly greater than 4 millimeters. Next, drop the incisal pin by the difference between these two measurements. Each increment on the incisal pin represents 1 millimeter of vertical opening. Thus, in this case, we will drop the incisal pin by approximately 4 1/4 millimeters. Now, using rigid stabilizers and compound sticks heated with a burner, lute the lower model to the upper with the bite record in place. It is important that the base of the model be totally dry when adding the compound, as compound will not adhere to wet or moist stone. Other acceptable materials for use in luting models together could include nails and hot glue. Continue this process by attaching stabilizers in 3 to 4 places around the models. Allow the compound to cool and become hard again to ensure that the models are firmly secured together. Note the accuracy of the fit between the teeth and bite records. Next, place a lower disposable mounting plate or one with pre-added mounting stone and reattach the now luted upper and lower models. Close the articulator together and ensure that the incisal pin has been lowered the amount required to accommodate for the thickness of the bite record. With the articulator now inverted, again note the amount of space present between the base of the model and the mounting plate, and hence the amount of mounting stone that will be needed. Now, just as before, moisten the base of the model and the adjoining preformed stone base with water. Alternatively, you may soak the preformed base in water while you are luting the models together. Once again, mix the proper amount of mounting stone according to the manufacturer's directions and fill in the space with just enough stone in order to minimize the amount of excess that will need to be removed. Close the articulator. Remove excess stone and smooth with moistened fingers, again keeping a tight grasp on the articulator. Firmly secure with string or heavy gauge rubber bands. Allow to set for 30 minutes. After the stone has set, remove the stabilizers from the models. The bite records are set aside and the models removed from the articulator. Any residual compound can be scraped from the models using a laboratory knife. Next, again using the lab knife, remove any excess mounting stone. Proceed to the use of wet-dry sandpaper and under running water smooth and polish the bases. During this polishing step, also note any voids in the stone. These voids can be easily filled with a thin mix of mounting stone then smoothed. The models are now placed back on the articulator any bite records removed and the incisal pin raised until the teeth come in contact. Continue to raise the incisal pin until it is slightly off the incisal guide table. Then tighten the thumb screw to secure it. Place articulating paper or ribbon between the teeth and gently tap to mark the first contact point. Verify the accuracy of the bite record and mounting process by comparing this mark with the first point of contact recorded in the mouth. To program the condylar inclination, a protrusive bite record is used. Simply have the patient slide their jaw forward into an edge-to-edge position and capture this relationship with a polyvinyl material or a rigid wax. Programming the condylar angle is strongly recommended for certain cases, such as when the anterior guidance cannot disclude the posterior teeth, Severe wear has resulted in loss of the upper lingual cusps or cases involving rehabilitation. Begin by loosening the condylar elements and detaching retaining springs so as to allow independent movement of the upper member of the articulator from the lower. Place the protrusive bite records on the lower teeth and position the upper teeth into them. Next, gently rock one condyle up and down until the teeth on the opposite side are firmly settled into the record. Tighten this condyle with the Allen wrench. Now, repeat the same process for the opposite condyle. Record this setting in the patient's chart for future reference. Lastly, remove the protrusive records and reassemble the articulator by attaching the retaining springs and locking the centric latch. The articulation process is now complete and ready for the treatment planning phase and case presentation. By following this process, one can ensure consistency, better accuracy in the diagnostic workup, and ultimately more precision in the restorative phase of the treatment to follow. Patients do appreciate this added effort you've put forth on their behalf, and it will help to differentiate your practice as one committed to their optimal health, function, and aesthetics.